Hi, I'm Zeenat Chowdhury-Jackson. I'm a physician. I wrote this book, Tears of Rain in the Pandemic, and a physician because I was that time very sad seeing all this, effect of pandemic and people being sick. Um, I I reacted a different way. I was starting writing poem. It was really soothing for me, and I wanted to share those poem with everybody.
Okay, so what inspired you to pursue writing?
Okay, I always wrote before, but I never pursued publishing. The whole situation during the pandemic as a physician, I was frontline worker, like I was working in the hospital. That time I felt that, clinically, physically, and mentally, I felt like we are exhausted. And I was really felt that all the people that we took care, some people obviously were very sick, some died. And it's like I felt something inside me. I was start writing because I felt so sad, and the writing was giving me really some kind of relief. Because in the past, I wrote in the paper about, lots of things happened in 2008 during the, Great Recession in America. I saw people how they suffered, how the patients was like, suffering. That time I wrote some, but I usually throw it away. But this time I couldn't because I felt that, I couldn't throw it, and then I pursued publishing.
Yeah, it sounds really cool through all those different like life events. So, what inspired you to pursue medicine?
I always wanted to be a doctor when I was younger, that I was playing with dolls, the emergency, and doctors, the playing with other friends when I was really very young. It felt that I always felt it was a feeling that, people got sick and they go to the hospital, and the nurse and physician and all the people in the hospital, especially the person who take care of the patient, is the doctors and nurses. And then after that, they get better and come home. I felt that, this is the profession I wanted to pursue because it gives people's, life back, and also give them comfort, and they come home. And that's why I pursue medicine. As you know, I'm from a country that usually female are, usually go to medicine because that's the, cultural thing, that that's all you can do as as a, female. So it was really rewarding for me. And I always thought to be a doctor. Obviously, I have also interest on like space, sky. I always wanted to fly, but that's a different thing. But usually, first thing, I always wanted to be a doctor because people get sick and they're really doctors, nurses, they take care of them and they come home.
Yeah, so with all these interests, writing, medical, and your personal life, how do you balance like all of your interests?
I mean, that's the thing that, writing is like, I don't need time because sometimes the emotions comes and I write in the car. Maybe I ate something, a donut, and I have a package. I start writing that on the package. Or maybe I have a napkin, I'm drinking some coffee, I start writing. So basically, it doesn't really, the writing really doesn't takes me what I'm doing. And obviously, being a physician, you're very busy. And as a family, they understand because my family saw me that I spend most of my time either with patient, either at work or studying. So they really, I spend quality time with them. But if you say that, that's what lots of people ask, when you get time to write, because it's like a moment, like I'm driving, suddenly emotions coming to me, I parked and I just write. So it's really doesn't take time. The time is like when you edit, you rewrite, and you submit to the publisher. That's the time consuming.
Yeah, that sounds like a lot to balance. Can you describe your experience of being a physician during the pandemic? Since that
Yeah.
seems to be like a basis of your book.
Yeah, but basically I sleep less. So that's like the balance happened. I mean, because I sleep less time. That's the time that I get, I put in writing another thing, yeah. And as a physician, how I felt during the pandemic, that is your question. Hello?
Yeah, like your personal experience with the
Okay,
pandemic.
personal experience, it was very, sad, and it was like every day things will be changing. Like I will be going for rounding, my patient is not there. Either they're sick, either they're in ICU, or either, they're not there. So it's kind of like then the treatment, then procedure, how we will do things. Initially, I felt like I was lost. Like, I felt that, in my whole career and all my colleagues can stand up. We never felt something like that. It was very sad. And we were physically, mentally, and clinically exhausted and tired. Physically means like, you have to put that N95 and wearing all this, gloves, and like going to the patient rooms and N95 with N95 until you are finished. You can't even go to the bathroom. That was like that was the situation. And physically, then of course, around the virus, sometimes you feel bad, sick. Then mentally, because you're seeing all these patients dying and you cannot help them. That's also one thing. And also clinically, because there was no proven medication that can really cure the disease. So it was a very challenging year.
Yeah, it's hard to like not have answers. So how did your medical specialty impact your experience at the pandemic?
Yeah, I mean, I have a fellowship, which is like endo, but I'm lucky that I really did, frontline physician. I was working in the hospital, COVID patient. That really gave me prospect that I saw the pandemic in different way. If I was a consultant, probably the book will be not written, because I will not see those things, what happening exactly. I will be the consultant. Like, you cannot connect the dot. The Steve Jobs said, you always have to connect the dot backward. So I felt that, I'm a physician, but I have inside something that I can express myself on the poem. That really, I found myself that I have other side that I enjoy writing. I mean, it happened because I was the first line caregiver, of course. And I felt that if there was not enough physician that time in the hospital, the patient will be suffering.
Yeah. So what was your purpose in writing your Tears of Rain in the Pandemic novel?
Yeah, it's like a poetry book. I wrote it because I felt that next generation or in the future, people can read it and look back what exactly a person or I think all the physicians felt the same, but they didn't write it. Some people did. I feel that, uh, I wanted to preserve my emotion and feelings during the time that I felt. And that's why, putting in a writing and book, I did that because I wanted to share with people that you are not the only one. There are other people, doctors who are mentally suffering and isolated and going through the same thing.
Yeah, and as you mentioned, like you did a book of poems. So what made you decide to pursue a book of poems rather than maybe like a different type of writing?
Yeah, I saw lots of doctors wrote something different, but I felt that there was not beginning or ending. I feel that poem is like a fraction of a moment, that how I felt emotion. Like suppose I saw somebody dying, how I felt that moment, I wrote it. And I think that poem is a powerful thing. I mean, of course, nowadays, we don't really pay attention, but I feel that it's an expression that can help the person who's writing and also people who can read it.
Yeah. So what is your advice for aspiring writers and doctors since you have like experience in both professions?
Yeah, I advice is do your work with your heart, and compassion and empathy is the most important thing. Most of the work will be done by robot, but emotional intellect, emotional intelligence, it will never be replaced. And I feel that if you have compassion and passion, if you do the work, I mean, your best. And of course, the universe will carry you when you are in the best moment and even you are in the worst moment. I will say that compassion and the empathy also can change the outcome of a disease, because you can relate to the patient. And, if you really put that compassion and empathy, I think that will be my advice to all the physician and writers, of course. They, like I said, that I was trained as a physician. I went to many, many years school. Still, as a physician, we have to study, but I was not trained to write poems. But that is the thing that I will say, that you express something when people read it, it will really, meaningful to them, and they will see the world in different prospect, maybe.
Yeah, yeah, all those things are very important. So, like your most recent book, Tears of Rain, it's not your only work. So,
Yeah.
is it designed to stand on its own, or are you trying to build like a collection of works that all connect to each other through your different novels?
I mean, the thing is that I'm working on another book that's really not, of course, I spend lots of time with people. My connection with my patient and every day seeing them, their suffering, their happiness, their retirement, their older life, it's impact in a different way, that it really makes me write, and I can connect my life to the other people. Basically, we are all human. I'm writing another one. I mean, I wrote many, but I never published. It was I just laughed at, or it's probably I threw it away. But this time I published, and now I will publish hopefully my next one. That will be another poem in general, how we interact with people, how I felt that day. I mean, different kind of collection. It will not only one book. I mean, I'm really hopeful that I will, in the future, I can publish more.
Yeah, that's really like aspirational. So, like every author deals with writer block at some point. Do you have any advice for going through writer's block, or have you gone through it yourself?
No, at this point, I'm so busy with my career and profession. Writing is like, I like it, I enjoy it. It's not yet my career. Of course, blog is like time consuming, and I don't have that much time. Though I just like, it works for me. Whenever my emotion comes, I write, and then I just type them and I publish them, and that works for me because I write maybe early in the morning or maybe late at night. So it works a different way because lots of people commenting and answering their question, not at this time, maybe when I will have retire, that time probably, but I really work well on my own, so I just wanted to write and just publish it. That's my next step. At this point, I'm not going to do another other format. Maybe I can just do video reciting my poem. I do like post my picture and I write something from my poem, my latest poem. I do sometime that, but not really interact with other people comments and writing.
Yeah, well, it's all really interesting from all your experiences in writing. But I think that's all the questions I had. Did you have anything else that you wanted to add?
I just wanted to tell everybody that I didn't write a book for just to have book. I just want people to read it, to understand that how the pandemic can really change somebody's prospect. Like I reacted different way. I just wrote poem and I published it. I was writing and it was comforting to me, and that's why I felt that I would suggest that new generation, they should really start reading, because every job in future will be changed by robot, but compassion, feelings as a human, that's really makes us different from artificial intelligence.
Yeah, that's super important. Well, that's all for today, everyone. Thank you, Dr. Jackson, for
You,
taking the
Sarah.
time. Yeah, thank you for taking the time to talk with us. And for everybody watching the video, if you haven't already, make sure to like, comment, and subscribe, and I'll see you next week.